Hi. So I'm going to start doing a series of questions that I've received from different women. Some of these are questions that will be in my new book, Asking for a Pregnant Friend. And some of them are, the more embarrassing questions that a lot of women don't want to ask, even their care providers. So I'm going to answer them on this channel. So one of the first ones is about that swollen vulva. I nicknamed myself Mama Moose Knuckle during pregnancy because it was so bad. I had the worst moose knuckle. I could not believe how swollen it got. And a lot of women I work with have the same experience. I had to swap my stretchy yoga pants for big flowy skirts because, sometimes it was embarrassing. I had one mom though who seriously had it, and she rocked those yoga pants. She's like, you know what? Like, I'm proud of my moose knuckle. I don't care if it makes people uncomfortable, so what? So that's also a choice. Like, who cares if you have that moose knuckle? Just go with it. And why is it like that? So a crazy thing that happens during pregnancy is that your blood volume increases by 50%. That's a lot. That is often caused, or it is caused, by the increase in estrogen and progesterone. This extra blood is supporting, the growth of the placenta, the growth of the baby. So we want it there, but again, it can cause some swelling, especially in that vulva. And as the uterus expands, it can also trap blood down in the pelvic region, which can intensify that swelling. A cool thing is, for a lot of women, that excess of blood in the vaginal region can actually increase their libido, make them super turned on. Any kind of friction in that area can be really exciting. So if you were in that camp, yay, congratulations. You're potentially always going to be a little bit aroused, which is kind of awesome. Some women experience some redness, burning pain in that area from that swelling. If that's something you're experiencing, definitely check with your care provider because it could be a sign of infection. Again, with anything that's questionable, check with your care provider. But if it just feels good but looks kind of embarrassing, enjoy it. Again, you can opt for the looser clothing, especially if it starts to irritate you. If it's always causing arousal or something like that and it bugs you, go ahead and opt for looser clothing. 100% cotton underpants can also help to reduce any irritation. And two other things while we're talking about the swelling that can happen in the vaginal region is the vulva, the skin around the vulva can potentially darken to have like a bluish purplish tint or develop varicose veins. This is all super normal. And most of the time, the varicose veins, the swelling, and any discoloration will go away a few weeks after you have the baby and your blood volume begins to go back down to normal. If you have any questions about that, go ahead and leave them in the comments below.